Hello, psychology scholars! Welcome to our last lecture for Chapter 1, An Intro to Psychology. In this video, we will focus on what psychologists do. To begin our discussion on what psychologists do, let's take a look at the difference between basic and applied research. The term basic research refers to studies and research that are meant to increase our scientific knowledge base. This type of research is often purely theoretical, with the intent of increasing our understanding of certain phenomenon or behavior, but does not seek to solve or treat these problems. Examples of basic research in psychology might include an investigation looking at whether stress levels influence how often couples fight, a study looking at how caffeine consumption impacts the brain, a study assessing whether men or women are more likely to suffer from depression, or a study looking at how attachment styles among children of divorced parents compare to those raised by married parents. Notice in all of these examples, the goal of the research is to simply increase the amount of knowledge on a topic, not to actually come up with a practical solution to a problem. Applied research refers to the scientific study and research that seeks to solve practical problems. This type of research plays an important role in solving everyday problems that often have an impact on life, work, health, and overall well-being. Applied research is used to find solutions to everyday problems, cure illness, and develop innovative technologies. A few examples of applied research in psychology include investigating which treatment approach is the most effective for reducing anxiety, researching which strategies work best to motivate workers, studying different keyboard designs to determine which is the most efficient and ergonomic, analyzing what types of prompts will inspire people to volunteer their time to charities, or investigating if background music in a work environment can contribute to greater productivity. As you might notice, all of these examples explore topics that address real-world issues. Basic research tends to focus more on big-picture topics to increase the scientific knowledge base around a particular topic. Applied research tends to drill down more towards solving specific problems that affect people in the here and now. For example, a social psychologist performing basic research on violence might look at how different factors might contribute to violence in general. A psychologist conducting applied research might tackle the question of what type of programs can be implemented to reduce violence in school settings. Psychologists can do basic or applied research, or they might decide to do both. Psychology's non-clinical specialties or major subfields. These, by the way, are not all of them. So the biological psychologist, we've already talked about. They study how biological systems lead to mental activity and behavior. Developmental psychologist studies how people change and grow over time, physically, mentally, and socially. In the past, their focus was mainly on childhood, but many now study adolescence, young adulthood, the middle years, or old age. Cognitive psychologist, we've already talked about. They study attention, perception, memory, problem solving, and language. Personality psychologist study enduring characteristics that people display over time and across situations. Industrial organizational psychologist studies behavior in the workplace. They are concerned with group decision-making, employee morale, work motivation, productivity, job stress, personnel selection, marketing strategies, equipment, design, and so on. Social psychologists study how people's thoughts, feelings, and behaviors are affected by other people or groups of people. Cross-cultural psychologists, not on this slide, study how people are influenced by societal rules that dictate behavior in their culture. They investigate similarities and differences in psychological functioning in and across various cultures and ethnic groups. Educational psychologists, also not on this slide, they're concerned with teaching and learning processes, like the relationship between motivation and school performance. They study psychological principles that explain learning and look for ways to improve educational systems. Their interests range from the application of findings on memory and thinking to the use of rewards to encouraging achievement. Experimental psychologists, not on the slide, they conduct lab studies of learning, motivation, emotion, sensation, and perception, physiology, and cognition. These psychologists tend to be statisticians. Don't be misled by the term experimental, though. Other psychologists also do experiments. Forensic psychologists, not on the slide, they focus on legal issues, like determining the accuracy of witness memories. Sports psychologists, not on the slide, apply psychological principles to athletic activity and exercise and motivation. So let's look at psychology's clinical specialties. So we'll start with psychotherapists. They help people with psychological problems that have built up over the course of a long time. They help people understand their feelings, thoughts, and behaviors more clearly. This tends to be a long-term process. They can include psychologists, psychiatrists, marriage counselors, life coaches, and social workers. They can have any number of degrees in a variety of disciplines, master's degrees, PhDs, MDs, or certificate in fields like social work, substance abuse, clinical psychology, and family counseling. If someone tells you they are a psychotherapist, always check their educational credentials and licensing. Counseling psychologist focuses primarily on educational, social, marital, and career adjustment problems. They help people identify problems and crises and encourage them to take positive steps to resolve these issues. This tends to be a short-term process. The focus is on problem solving and learning specific techniques for coping with or avoiding problem areas. They tend to be in schools and counseling centers, and they may also be advisors. They can have a master's degree, PhD, or PsyD. Clinical psychologist studies, assesses, diagnoses, and treats people with psychological disorders. They might have a PhD, an EDD, or a PsyD. Psychiatrists, on the other hand, are medical doctors with an MD with a specialty in psychiatry who use treatments like drugs and psychotherapy to treat psychological disorders. They do work that is similar to a clinical psychologist, but is likely to take a more biological approach. Psychiatrists are more likely to prescribe medication, whereas a clinical psychologist would refer their clients to a psychiatrist for medication. Psychologists work in many different settings. To name a few, in business, sports, government, law, military, and so on. This last slide for Chapter 1 states some of the things that psychology could do for you. It can make you a more informed person. It can satisfy your curiosity about human nature, help you increase your control over your own life, help you on the job, and give you insights into political and social issues. So this concludes Chapter 1.